Yeah, so I have been much more successful as an NSF-funded researcher throughout my career, from getting a NSF dissertation grant to this most recent project that was funded just a few months ago. And so the project really focuses on domestic violence, but as I'll talk about in the last couple of slides with some sort of tips and tricks for NSF, you have to be a little bit broader. So our focus was really on social services infrastructures and their role in pandemic response. And so, as I'm sure everyone knows, domestic violence is a massive problem, estimated 12 million victims a year in the U.S. And in the U.S., it's estimated to be about an 8.1% increase since the pandemic onset. And some of these are from December 2020 numbers, so you can see that this was a global problem. And again, just like every other type of surveillance, we know that this is an underreport. So what we were interested in doing, and by we I mean myself and a faculty member in sociology and criminal justice and one in the College of Education, was looking at the public health control measures that we implemented to control the pandemic emergency and how those may have inadvertently increased the risk to victims and survivors of domestic violence. And so it makes sense to think, if we told you to stay at home and stay distant from others, to isolate. We closed schools, we closed courthouses, we closed all kinds of other services, that meant that victims were, at home with people who may may experience domestic violence. And it was interesting because, there's still a lot coming out on this, but it appears that there were a lot of first time and then a lot of escalation. So, the introduction of being at home, perhaps with a gun, or in those kinds of situations. So definitely sort of the motivation to implement these control measures had unintended negative consequences with some populations. And so this grant is really to look at how disasters more generally make it difficult to deliver empowerment-based services. So the sort of, in as much as it is, I think there have been two sort of clinical trial designs on this. We know that empowerment-based services improve outcomes and reduce violence. And, there are papers with a theoretical framework, and so they're, operating within the social context and all of this kind of thing. So our sort of added piece to this empowerment model is thinking about resources as part of a network of social service infrastructures that are disrupted during a disaster or an emergency. And I think a lot of these things are really key with NSF in terms of having a conceptual framework and then pushing it forward, are some of the things that they're looking for you to do. So the activities in this grant are not really very innovative, so to speak. The real innovation is really pushing this theory forward to both apply it to domestic violence specifically, and also to push it into the disaster and public health emergency realm. So we're in the process of interviewing state and territorial domestic violence coalition executive directors, and I'm sure no one would be surprised to hear that the things they're talking about are staff turnover, burnout, the difficulty of operating shelters at lower capacity due to distancing guidelines, and they just really didn't have the technology available or the funding to get it, to let people, who were living in shelters, let their kids go to online school, or let people go to court, support people who needed to go to court hearings virtually. And so the technology piece, as a lot of services moved towards a virtual environment, was really hard. So using what we find there, we're doing an online survey of service providers. So that has a much larger N. and then using those findings to develop tools and resources to improve resilience to future disasters. And sort of how this fits in the greater NSF framework, like I mentioned, everything has to be grounded in a theory. And epidemiology, we're the least theoretical, I think, of any of the public health fields. And I would imagine that I'll just lay that on clinicians and say that, we don't really think that much about theory in epidemiology. So this is something we have to sort of work hard. NSF is not interested in research that what they call describes the state of affairs or policy. They're not really interested in something that tests the theory or assesses outcomes. They're really interested in this theoretical framework and how your research pushes that to a new level in some way. And so the directorate that I'm funded in is called Humans, Disasters, and Built Environments. So I have I guess it's HDBE. So the proposal really has to have an element of people, disasters, and environments. And so they fund a lot of engineers looking at things like transportation infrastructures or, communication infrastructures. And so because we know this directorate is interested in built environments, we had to explicitly, convince the reviewers that this social services system, which people need after a disaster, is an infrastructure that is affected by disasters, can't function in a theoretically sound way at post-disaster. And, we need to understand that in order to make it more resilient. So that was our sell, I guess it worked. In general, NSF program officers are extremely willing to talk to you both before you submit and then if you want to resubmit after not being funded. They give a lot of guidance that I think is very straightforward and helpful. The review criteria, and I don't know if others have had the chance to be on NSF review panels, but there are basically only two criteria: intellectual merit and broader impacts. And so intellectual merit is the science, is this good science? And the sort of, the death knell of being in a NSF review is if someone says your science is incremental, right? They really want you to push this theory or this framework forward in a substantial way. And the broader impact piece is supposed to be weighted equally, but having been in lots of these review panels, it isn't really. But that's the potential to benefit society. So that's why we have that third part of our project, which is developing tools and resources for service providers so that they can be more prepared and more resilient. NSF likes pilot data to sort of show that you have a proof of concept that your idea will work, but it's not as essential as an NIH proposal. We had done a preliminary study for this proposal, and we ended up using probably two or maybe even closer to 3 of our 15 pages talking about it because we felt like this was a subject area that the reviewers may not be that familiar with. And the last thing I wanted to just go back on again is that this really has to be applicable to systems. So, in our world, like in the disaster research world, we know those systems are inherently complex and likely chaotic, and that fixing one thing doesn't, sort of make everything better. Like that engineering approach of like, if only we had perfect information, we could make the right decisions and everything would be fine. Not so, right? So really has to, I guess, round up to this systems approach. So that's what I had. I'll stop sharing so I can see people again.